This is Dr. Greg McGrew, and I wanted to talk to you today a little bit about clearing up some of the confusion that you might encounter when you're trying to pick up some eye care products at the drugstore. The choices that you have can be a little overwhelming, and for instance, if we take a look at the cold and flu aisle at the drugstore, we'll see that there is basically a wall of different choices. So it can be a bit overwhelming. And if we move on over to the eye care product aisle, we'll see that there's also a lot of choices here. Not nearly as many as with the cold and flu, but still, you're coming in for one specific product for one specific problem, and you see in front of you dozens of choices. So what's nice about this particular display we're looking at here is that the pharmacist has taken it and broken it down into categories. Up on top, it's labeled for the dry eye, and below that we have the allergy products, and below that it says redness, and down on the bottom it's labeled specialty eye care, which essentially means miscellaneous. And that may not look quite as overwhelming as the cold and flu aisle did, but there's still many choices there. And if you throw in the contact lens solutions as well, as we can see in the next picture, then we've just doubled the amount of shelf space, doubled the amount of choices, and sometimes the boxes look pretty much just the same. But let's just kind of break it down into categories. When you start talking about dry eyes, there's a reason that that's on top of the display in the most prominent position with the most choices, because it's the most common reason people go looking for drops. It's something for dry eyes. And you may remember that your neighbor or your friend or your doctor said to get Sustain, but when you get there, you find out that there's 6 or 7 or 8 different Sustain products. And maybe it's another brand, it's the Refresh. We see that the Refresh is just as bad. So you might then ask, what is the best product for dry eyes? And the answer, of course, is it depends. But what are the causes of dry eye? That might help us get to the bottom of it. Basically, dry eyes can come from a number of things. Main factors being age, medications you may be taking, hormones are sometimes a factor, heredity, mom has dry eyes, I have dry eyes, and environment. People who live out west, where there's not much humidity in the air, people who work in very dry environments, winter time, these are things that can aggravate the dry eye situation. But when it comes to the mechanics of dry eye, there's basically 2 main causes of dry eyes. You either simply don't have enough tears, or the tears you have are not enough good quality, they don't stay on your eye. Essentially, usually they just evaporate off your eye too fast. And in fact, what recent studies have shown is that about 85% of the people that suffer from dry eye have what we call evaporative dry eye. That means the tears just evaporate off your eyes too quickly and your eyes dry out as the day goes on. And so for that reason, the drops that are most effective for most people are what we call lipid-based tear drops. And the idea is that they put a little bit of film of oily lipid layer on top of your tears so your own tears don't evaporate off too quickly. And so I'm going to show you here 4 of the most commercially available lipid-based tear products. We have the Sustain Balance, the Refresh Advanced, the Soothe XP, and the Retain. Alright, so all 4 of those. As I mentioned earlier, there are a number of Sustain products available. You have to be very careful that you're getting the Sustain Balance, okay, because that's the one that's lipid based. And conversely with the Refresh, it has to be the Refresh Optive Advanced, and that is the lipid based product. Within the Soothe, you want the Soothe XP, okay? And as far as I know, Retain is only Retain. So that's what we're looking for there. If we move on to allergy relief, we can again look down at the choices. What's featured here on this slide are the only over-the-counter products that are true antihistamines. And actually the Aloe and the Zaditor are both the same thing. It's just, they're packaged differently. And in this particular example, there's a generic product. It's interesting to note that it's labeled exactly like the Zaditor, same orange color. And in this case, it is exactly the same product. So it's a generic version of the Aloe and the Zaditor. So that brings up the point that you want to be careful with generics, that you're getting what you think you're getting. There are some other allergy products. I kind of call them the oldies but the goodies. And if we look down over onto the right side of the allergy display, which is the middle aisle here, the middle row, the oldies but the goodies there are the Opcon A and the Nafcon A. I have some patients that prefer those to the newer antihistamine products, and I think they're good allergy drops. Again, the Nafcon A and the Opcon A are identical. They're just labeled by different manufacturers. If we go down a little bit lower here in this particular display, I think the products are down on the bottom because they're less useful. The red eye products I don't think have much therapeutic value at all. They may be a little bit helpful if you're having allergy issues, but in most cases they're just covering up a problem by constricting your blood vessels, making your eyes look less red, and aren't really helping anything. And in fact, if your eyes are dry, you could argue that it's exacerbating the situation or making it a little bit worse. And down below there on the bottom row, the rest of the stuff, again, there's not much there that I think has much therapeutic value other than the lid wipes. In the case of people who have crusty eyelids, discharge on the lids, itchy eyelids, those lid wipe products can be very, very helpful. The eye wash may have a place in a work environment where you're worried about things getting in the eyes. But again, I think these sty remedies and some of these homeopathic drops don't have a whole lot of therapeutic value for us. So I hope this has been helpful in kind of breaking things down for you. I appreciate your attention. Here I've provided our contact information. Go ahead and give us a call if you have more questions or you want to have a visit with us. And please check out our website where you'll have access to information like this and other articles and things we've made available for you about our office. And also engage with us on Facebook.